In this video, we will learn about one of the autoimmune diseases, myasthenia gravis. Before proceeding further, we need to understand what is meant by autoimmune disease. It is a condition in which the body's immune system mistakes its own healthy tissues as foreign and attacks them. Most autoimmune diseases cause inflammation that can affect many parts of the body. The parts of the body affected depend on which autoimmune disease a person has. Now, when the affected parts of the body are skeletal muscles, which are caused by the damage to the neuromuscular junction in our body. The neuromuscular junction, also called the NMJ, is a synaptic connection between the terminal end of a motor nerve and a muscle. In this case, the NMJ of skeletal muscles is weakened and destroyed, causing atrophy. But, who attacked them and why? As we know, when a foreign substance enters our body, our defense mechanisms conquer them with the release of antibodies in the blood. But in this case, antibodies are unable to identify the foreign substances and attack and kill them eventually, but in this case, antibodies mistake the muscle receptors for foreign bodies and attack them. This blocks a chemical needed to stimulate muscle contraction. Myasthenia gravis is a neuromuscular junction autoimmune disease caused by antibodies that attack components of the postsynaptic membrane, impairing neuromuscular transmission and causing skeletal muscle weakness and fatigue. This can affect the entire body or just a few muscle groups, and there could be involvement of the bulbar and respiratory muscles, which can be fatal. The target, an isotype of autoantibodies, play an important role in the pathophysiology of myasthenia gravis. Let's have a look at pathophysiology of myasthenia gravis. Antibodies against the acetylcholine receptor, IgG1, and IgG3 cause the majority of cases. In those patients who do not have acetylcholine receptor antibodies, antibodies to muscle-specific kinase or MuSK, or related proteins such as agrin and low-density lipoprotein receptor, related protein 4 are present. MuSK antibodies are predominantly IgG4 and cause disassembly of the neuromuscular junction by disrupting the physiological function of MuSK in synapse maintenance and adaptation. Note, myasthenia gravis is an autoantibody-mediated illness that is well known. Antibodies against the acetylcholine receptor are identified in 85% of individuals with generalized muscular weakness, and 50% of those with mainly ocular symptoms or symptoms related to the vision of patient. The patient with myasthenia gravis, who is present with complaints of muscle weakness and fatigue, may vary rapid in intensity over days, or even hours, and worsen as muscles are used, that is early fatigue. Facial muscle involvement causes a mask-like appearance, a smile may appear more like a snarl. Ocular symptoms include ptosis, or drooping eyelids, and diplopia, or double vision. In some cases, there could be trouble swallowing or pronouncing words. Now, let's understand how to diagnose patient with myasthenia gravis. Testing how you respond to certain drugs is a typical technique to identify myasthenia gravis. When you take an anticholinesterase medication, your muscle weakness usually improves dramatically over a short period of time. Myasthenia gravis is confirmed if you respond to the medication. Other methods to use are blood tests, in which we look for markers that may be present in people with myasthenia gravis. Mainly the anti-acetylcholine receptor antibody test is reliable for diagnosing autoimmune myasthenia gravis. It is highly specific, as high as 100%. Also, nerve conduction studies are a type of study that looks at how the nerves transmit information. Myasthenia gravis is diagnosed through a procedure known as repeated nerve stimulation. An electromyogram or EMG test is a kind of test that evaluates a muscle's electrical activity. Diseases and neuromuscular problems can cause aberrant electrical muscle activity, which can be detected using an EMG. Now, let's have a look at treatment options available. The goal of treatment is to improve muscle function while also preventing issues with swallowing and breathing. The majority of people with this illness may strengthen their muscles and live regular or nearly normal lives. In more serious situations, assistance with breathing and eating may be required. The medicines used to treat myasthenia gravis. Anticholinesterase drugs, steroids, or immunosuppressive drugs may be administered to reduce the immune system's reaction. Thymectomy. The thymus gland is surgically removed. The thymus gland's function in myasthenia gravis is unknown, and thymectomy may or may not help symptoms. It does, however, improve symptoms in more than 70% of persons who do not have thymus cancer, probably via modifying immune system response. Next, plasmapheresis. A process in which aberrant antibodies are removed from the blood and replaced with normal antibodies obtained from donor blood. Next, immunoglobulin. A blood substance that aids in the reduction of the immune system's assault on the neurological system. It is administered intravenously. Myasthenia gravis has no cure, but the symptoms can often be managed. Myasthenia gravis is a chronic illness that lasts a lifetime. Early diagnosis is the key to controlling the illness.